Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering NCLEX preparation. Guys, if you haven't done so already, you know what I'm about to ask you to do. Please do not forget to go ahead and press that like button and subscribe below if you haven't done so already. Don't forget, guys, I got resources available on my website for you, nexusnursinginstitute.com. And don't forget to follow me across all my other social media platforms such as Instagram, Facebook, and TikTok. Okay, guys, without any further ado, let's get started. First question. A woman's admitted to the labor and delivery unit in sickle cell crisis. Which of the following nursing actions has the highest priority? 1, administer oxygen. 2, turn it to her left side. 3, provide adequate hydration. Or 4, start antibiotics. And guys, the correct answer is 3, provide adequate hydration. Why? And I know so many of you guys were tempted to choose oxygen, but let's think about this. If a patient's in sickle cell crisis, what's the problem? The problem is that those RBCs are now sickled. They're not disc-shaped anymore. They're sickled, and so they're unable to what? Flow through the vessel. Well, why is that a problem? What do RBCs contain? Hemoglobin. What does hemoglobin carry? Oxygen. So the problem is not that the patient doesn't have enough oxygen. They have enough oxygen. The oxygen is in the hemoglobin that's in the RBC. The problem in the situation is the oxygen that's being carried in the hemoglobin is not moving. And the reason it's not moving is because those cells, the RBCs, have become sickled. So the minute that you hydrate that patient becomes hydrated. Those same RBCs that took that sickle shape has now taken a round shape, and guess what? It's flowing freely. So the oxygen that's being carried by the hemoglobin, that's part of the RBC, is now free to go to those vital organs such as your brain, your liver, your kidney, your spleen. Okay? That is what the problem is, guys. So do not be tricked by this question. When the patient's in sickle cell crisis, all of those RBCs are now sickled and they're not moving. They're just clumping up and actually putting that patient also at risk to have a stroke if that vessel bursts. But the minute you rehydrate that patient, those sickle cells turn back into circular shape so they can move freely, and the oxygen that's being carried can go where it needs to go. So the first thing you're going to do, guys, is rehydrate that patient. Right after you rehydrate that patient, you're going to place mom on her left side, because placing her on the left side is going to increase perfusion, not only to mom, but to the fetus. And then you can go ahead and give oxygen in that order. Okay? Next question. A client with peptic ulcer had a partial gastrectomy and vagotomy, Bill Roth 1. In planning the discharge teaching, the client should be cautioned by the nurse about which of the following? 1, sit up for at least 30 minutes after eating. 2, avoid fluids. Sorry, guys, I got this hair in my eyes. 3, increase the intake of high carb foods. Or 4, avoid eating large meals that are high in simple sugars and liquids. And guys, the correct answer is 4, avoid eating large meals that are high in simple sugars and liquids. Why? We want to prevent dumping syndrome. Whenever you see a test question and they're talking about this type of procedure, the gastrectomy, part of the stomach has been removed, the Bill Roth 1, you need to be thinking, a couple things need to be in the back of your mind. You need to obviously be thinking about dumping syndrome, right? But you also need to be thinking about, oh my gosh, what is that anemia? When the intrinsic factor, you're missing the intrinsic factor. Oh my gosh. Somebody put it in the comment section, because I'm having a brain fart. But when part of the stomach's removed, you're missing that intrinsic factor, and you're going to need vitamin B12 for the rest of your life. I cannot think of the name of it. But anyway, those are the 2 things you need to be thinking about whenever you see a test question about patient missing a portion of their stomach. So nut 4 is correct answer. You don't want that patient to have dumping syndrome. I can't think today. So let's look at our wrong answer choices. Look at number 1. Sit up for at least 30 minutes after eating. That is the type of advice you give what to a patient that has GERDs, gastric esophageal reflux. You want them sitting up so the food along with the hydrochloric acid doesn't creep back into the esophagus. But this is not a GERD patient we're dealing with. We're dealing with a patient that had a portion of their stomach removed. They had a Bill Roth 1, so that's incorrect. 2, avoid fluids between meals. Again, guys, part of this patient's stomach has been removed. We want to prevent gastric syndrome. For number 2, this is incorrect. Fluids should be given between meals. Now, notice I said between, not with, but between meals. Choice 3, increase the intake of high carb foods. Actually, no, we want to decrease the intake of high carb foods. We don't want high carb foods, and we don't want spicy foods. Okay, so the only correct answer in this choice that's been given to us is choice number 4. Which of the following is assigned to, the nurse is assigned to work with patients of a mentally disabled child? Which of the following should the nurse include in the care plan for the parents? 1, interpret the grieving process for the parents. 2, discuss the reality of institutional placement. 3, assist the parents in making decisions and long-term plans for the child. Or 4, perform a family assessment to assist in the planning of intervention. And guys, the correct answer is 4. You want to perform a family assessment to assist in the planning of intervention. How will you know what nursing interventions you're going to need to perform for this family if you haven't assessed their needs? The first thing you have to do is assess their needs, assess their understanding of what's happening, assess their understanding of what needs to be done for this patient. And then when you have an idea of their needs, then you can go ahead and do your nursing interventions for this patient. That's why number 4 is the correct answer. The nurse should explain to a client that Oronase is effective for diabetics who, 1, can no longer produce insulin, 2, produce minimal amounts of insulin, 3, are unable to administer their injections, or 4, have a sustained decreased blood glucose. And guys, the correct answer is 2, produce minimal amounts of insulin. Why? Well, Oronase, guys, this is an oral hypoglycemic, and to be specific, it's a sulfonylurea. Okay, remember what the sulfonylureas do. They knock on the pancreas. They're like, pancreas, wake up. I need you to shoot out more insulin, right? So sulfonylureas only work for type 2 diabetics, because remember, the type 2 diabetics, they're the ones who, they're making a little bit of insulin, but they're just not making enough to sustain life, right? But that pancreas is still functioning. So the job of the sulfonylureas is to just shake that pancreas up and say, wake up, I need you to shoot out more insulin. And so the patient's body will naturally make more of that insulin for the body's metabolic needs. So it has to be for a type 2 diabetic, because remember, the type 1s, that pancreas is dead. It's shot. It's not making any insulin. That's why the patient who's a type 1 diabetic is what? Insulin dependent. They have to get an exogenous. And when I say exogenous, I mean outside source, okay? So endogenous means from within. The body's making it, like the type 2. Exogenous is your type 1. They are dependent on an exogenous, an outside source of insulin, or they will die because their pancreas is not making that for them. So now let's look at the wrong answer choices. 1, can no longer produce any insulin. No, that's for type 1. Choice number 3, are unable to administer their injections. If a patient is insulin dependent, they have to have that insulin. A sulfonylurea is not going to do anything for them. They need that exogenous source. So either a family member or a nurse, somebody has to give it to them. Choice 4, have a sustained decreased blood glucose. No, sulfonylureas are for what? Patients who have increased blood glucose. Sulfonylureas are patients who have hyperglycemia, not hypoglycemia. Next question. A woman at 38 weeks gestation comes to the ER with complaints of vaginal bleeding. Which of the following statements, if made by the client, would suggest to the nurse placenta previa as a cause of bleeding? 1, I feel fine, but the bleeding scares me. 2, I've been more nauseated during the past few weeks. 3, the bleeding started after I carried 4 bags of groceries. Or 4, I've been having severe abdominal cramps. And guys, the correct answer is 1, I feel fine, but the bleeding scares me. So I cannot stress this enough. The characteristic symptom, sign and symptom of placenta previa is painless bleeding. If it's painless, it's placenta previa. If it's painful, you're dealing with what? Placentia abruptio, or abruptio placentae, okay? Painless, placenta previa. Painful, abruptio placentae or placentio abrupto, depending on the book that you're using. Okay? Next question. The nurse is caring for an 80-year-old client with Parkinson's disease. Which of the following nursing goals is most realistic and appropriate in planning care for this client? 1, return the client to usual activities of daily living. 2, maintain optimal function within the client's limitations. 3, prepare the client for peaceful and dignified death. Or 4, arrest progression of the disease process in the client. And guys, the correct answer is 2, maintain optimal function within the client's limitations. So guys, we're dealing with Parkinson's disease. What's Parkinson's? So Parkinson's, the patient has those TRAP symptoms, T-R-A-P, T's for the tremors, R's for that rigidity, A's for akinesia. What's my P stand for? Oh, postural instability, right? That's a picture of your Parkinson's patient. And the problem in Parkinson's disease is that the patient doesn't have enough what? Dopamine. That they do not have enough dopamine. So anyway, getting back to this question, the most realistic goal is number 2, to maintain optimal health within the client's limitation, because something you have to remember, Parkinson's disease is progressive. That means as time goes on, it's only going to get worse. There is no cure. We can only treat the symptom as much as we can, but it is a progressive disease. Now, it's not terminal. It's not going to kill the patient. The patient's not going to die from it, but it is progressive, and there are lots of complications that can kill the patient that we have to watch out for. So let's look at our wrong answer choices. 1, return the client to usual activities of daily living. That's not realistic. This disease is progressive. It's only going to get worse. So we're not going to go back in time to bring them back to their earlier activities of daily living. That's just not realistic. Choice 3, prepare the client for death. This doesn't kill the client. It's not terminal, right? But there are some complications that can happen that can kill the client, such as the patient aspirating and getting pneumonia. But this disease itself is not terminal, so that's wrong. And then 4, arrest the progression. There is no way to arrest the progression of the disease. It's going to progress. As time goes on, it's only going to get worse. So the only correct answer choice here, guys, is number 2. When using restraints for an agitated or aggressive patient, which of the following statements should not influence the nurse's actions during this intervention? 1, the restraints or seclusion policies set forth by the institution. 2, the patient's competence. 3, patient's voluntary and involuntary status. Or 4, the patient's nursing care plan. And guys, the correct answer is 3, the patient's voluntary and involuntary status. That does not matter to us. It does not matter to us. So a patient could have admitted themselves, they came voluntarily, but something happens that they lose control, that guess what? They can be what? Involuntarily admitted or kept. Okay, so if we decide if something's going on with the patient where they're not having control of themselves and they may be a harm to themselves or others, and we're putting them in restraints, them, signing themselves in voluntarily will not be a deciding factor on us putting them in restraints or not. Okay, we don't care about that. It does not matter. Now let's look at our other answer choices. 1, the restraint seclusion policy set forth by the institution. We care about that. We want to follow the rules and the policies. 2, the patient's competence. We care about that. Guys, remember, we always want to go from least invasive to least invasive and least restrictive to more invasive or restrictive. So if they're competent, they're able to follow directions, and they're being a hot mess and we tell them to stop. If they're competent and they stop, do we need to put them in restraints? No. So we care about that. Choice number 4, the patient's nursing care plan. We want to follow that. We want to go from least restrictive, least invasive, okay, and move up. So the only thing that we don't care about is their voluntary, involuntary status. If they are a danger to themselves or others and it's deemed necessary for them to be in restraints, they're going in restraints, and we're going to have to get that doctor's order. And that doctor's order has to be renewed every 24 hours. Next question. A 12-year-old boy injured his right knee yesterday during a soccer game. He's brought to the outpatient clinic by his mother. His right knee is painful, swollen, and bruised. During the interview, the nurse learns that the boy has hemophilia A. Which of the following medications would be best for the patient? 1, oxycodone, 2, ibuprofen, 3, aspirin, or 4, codeine. And guys, the correct answer is 4, codeine. Codeine is an analgesic, guys, and it's given for like moderate to severe pain. The other choices, guys, can increase the patient's bleeding. The oxycodone, the Motrin, and the aspirin, all of those can slow down the clotting, right? And it can cause the patient to bleed further. So the only correct answer, guys, is number 4. The parents of a 1-month-old boy bring their son to the clinic for evaluation of a possible right dislocated hip. If a diagnosis of unilateral dislocation of right hip is made, which of the following symptoms will the nurse observe? 1, limited adduction of the right leg. 2, uneven gluteal fold and thigh crease. 3, increase in length of right limb. Or 4, internal rotation of the right leg. And guys, the correct answer is 2, uneven gluteal fold of thigh creases. So guys, you're going to see them both get what? Longer and deeper, okay? Let's look at the wrong answer choices. 1, limited adduction of the right leg. No, you're going to see what? Limited abduction. Abduction. So it's the ability to separate them will be limited, okay? Remember, adduction, ADD, is when we add things together, and abduction is when we separate. Choice number 3, increase in the length of the right limb. No, we're going to see a decrease in the length of the right limb. And choice number 4, internal rotation of the leg. Depending on how it's dislocated, you may see internal rotation, but you may not. But definitely choice number 2, you're going to see uneven gluteal fold and thigh creases, okay? It's going to be what? Deeper and longer on the side of that dislocation. The nurse is administering terbutaline breathing to a client in labor. Prior to the administration of the medication, the nurse assesses the client's pulse to 144. The nurse's priority action should be to 1, withhold the medication, 2, decrease the dose by half, 3, administer the medication, or 4, wait 15 minutes and recheck the rate. And guys, the correct answer is 1, withhold the medication. Why? Tachycardia is a side effect of this medication. Pulse is supposed to be 60 to 100. Mom is at 144. You're going to go ahead and give her breathine? Absolutely not. You're not a killer. You're not going to do that. So let's look at the other answer choices. 2, decrease the dose by half. Okay, well, you're not a killer, but you're playing doctor, and you may be a killer by even doing that. You can't play doctor. You can't decrease the dosage. You either give it or you don't. Choice 3, administer the medication. Yeah, you're definitely a killer now. We're not going to give that medication. And choice 4, wait 15 minutes and recheck. Absolutely not. You're going to withhold the medication, call the doctor, let them know you withheld medication, and get new orders, okay? If you just wait 15 minutes, you're just letting that patient die slowly. You are not going to do that. You're going to withhold the medication and place a phone call to the physician. Next question. The nurse is supervising the staff providing care to an 18-month-old hospitalized with hepatitis A. The nurse determines that the staff's care is appropriate if which of the following is observed. 1, the child's placed in a private room. 2, the staff removes the toy from the child's bed and takes it to the nurse's station. 3, the staff offers the child French fries and vanilla milkshake for a mid-afternoon snack. Or 4, the staff uses standard precautions. And guys, the correct answer is 1, the child is placed in a private room. Remember, this patient's going to be on contact precautions. Oh, we're going to need to be changing that child's diaper, right? So that patient definitely is going to be on contact precautions. And just rule of thumb, when a patient has an infectious disease, you always want to put them in a room by themselves. If you cannot put them in a room by themselves, you will room them with someone else that has the same type of infectious disease. All right. Choice 2, removing the toy from the child's bed and putting it in the nurse's station. That toy may be contaminated. Everything has to stay in that patient's room. Choice 3, giving them French fries and vanilla milkshake. No, this child has hepatitis A. So with that diet, yes, we want to increase the carb and protein. Carb is good for what? It's going to give the patient energy, right? I'm thinking of calories. We want to give the patient energy, and we want the patient to be gaining weight, because with this disease process, they may lose weight, right? But protein, what's protein also good for? Wound healing. It's going to help them fight off this infection. So yes, you want to give them high carb, high calorie, high protein, but decrease fat. Okay, we're trying to rest that GI system, including the pancreas that releases what? Those enzymes to break down fat. So remember, with hepatitis A, increase calories, increase carbs, increase protein, all of those for what? Healing, but decrease fat. And choice 4, the staff uses standard precaution. No, you're going to use what? Contact precautions for this patient that has hepatitis A. The nurse is preparing to administer an injection of Haldol. Which of the following actions by the nurse is most appropriate? 1, massage the injection site. 2, give deep IM in a large muscle mass. 3, use a 2-inch 25-gauge needle. Or 4, administer the medication in divided doses. And guys, the correct answer is 2, give deep IM in a large muscle mass. Why are we doing this? This medication is very irritating to the subcutaneous tissue. So we want to make sure that we give it an area that there's a lot of muscle, so that it does not creep to the subcutaneous tissue, because it's very irritating. Now let's look at our wrong answer choices. 1, massage injection site. No, I just told you that it's irritating to the subcutaneous tissue. We do not want that medication getting to the subcu area. 3, use a 2-inch 25-gauge needle. No, you actually want to use a 21-gauge. Remember, guys, the higher number you go, the smaller that hole is at the tip of the needle, and the lower, the bigger, okay? Number 4, administer the medication divided doses. No, you're not. You're going to give that medication IM in one single dose. The nurse is monitoring a client's EKG strip and notes coupled premature ventricular contractions greater than 10 per minute. The nurse should expect to administer which of the following? 1, atropine sulfate. 2, isoprel. 3, verapamil. Or 4, lidocaine hydrochloride IV. And guys, the correct answer is 4. You're going to give the patient the lidocaine. We are going to give the lidocaine, guys, in patients that we find have coupled PVCs, or if they have PVCs of more than 6 to 10 per minute, you're going to give the lidocaine. Now, let's look at our wrong answer choices. 1, atropine sulfate. Atropine sulfate, that's an antidysrhythmic, and we give that to what type of patients? Patients that have what? Bradycardia. Choice 2, isoproterenol. This also is an antidysrhythmic, and this we give to patients that have like heart block or ventricular dysrhythmias. Choice 3, verapamil. That's actually a antihypertensive med. And to be more specific, what type of antihypertensive med is that? It's a calcium channel blocker. So we give that for blood pressure. And so the correct answer, guys, is number 4. A client newly diagnosed type 1 diabetes mellitus is being seen by the home health nurse. The doctor orders a 1,200 calorie ADA diet, 15 units of NPH insulin before breakfast, and check blood sugar 4 times a day. When the nurse visits the client at 5 p.m., the nurse observes the man performing blood sugar analysis. The result is 50. The nurse should expect the client to be 1, confused with cold, clammy skin and a pulse of 110, 2, lethargic with hot, dry, and rapid, deep respirations, 3, alert and cooperative with blood pressure of 130/80 and respirations of 12, or 4, short of breath with distended neck, veins, and bounding pulse of 96. And guys, the correct answer is 1, confused with cold, clammy skin and a pulse of 110. Remember, I talked to you guys about this already. If they're cool and clammy, they need candy. And if they're hot and dry, their sugar's too high. So look at number 1, confused, Cold, clammy, they need some candy. Why are they confused? Well, they don't have, remember, your brain feeds on what? Glucose. So if all that glucose is stuck in the blood, it's not getting to the tissues, it's not getting to the organs such as your brain, of course you're going to be confused because your brain is not being fed, it's not being perfused. Let's look at our wrong answer choices too. Lethargic, hot, dry, rapid respirations. Hot and dry, sugar too high, right? So that's not it. 3, alert and cooperative, blood pressure 130/80, respirations 12. All of this is normal. This can't be the answer. We know something's wrong with our patient. And choice 4, short of breath, distended neck veins, bounding pulse. You see this, you should be thinking of fluid overload, most likely caused by what? Congestive heart failure. Okay, so the correct answer is number 1. The nurse's initial priority when managing a physically assaultive patient is to 1, restrict the client to the room. 2, place the client under one-on-one supervision. 3, restore the client's self-control and prevent further loss of control. Or 4, clear immediate area of other clients to prevent harm. And guys, as much as I know you're tempted to choose 4, the correct answer is 3. We want to restore the client's self-control and prevent further loss of control. Now, we would love to do that just by warning the client and saying, you need to relax. But that doesn't work all the time. Remember, we go from least invasive to most invasive. So if that doesn't work, we might have to put that client in restraints and physically bring them under control. Or we might have to chemically bring them under control. But our first priority is to bring that client under control, right? Look at choice number 4, which I know you guys were tempted to choose. Clear the immediate area of other clients to prevent harm. That's not always realistic because things can escalate very quickly. So choice number 4 is the immediate second choice, but the first choice is to bring that client under control, okay? We want to make sure that they don't bring harm to themselves or others. And immediately after that, clear the area if we're not able to control that client, okay? So that's what we want to do in that order. Next question. The nurse observes an LVN perform a wet to dry dressing change on a 2-inch abdominal incision. Which of the following behaviors, if performed by the LPN, would indicate an understanding of proper technique? 1, a clean cotton ball is used to cleanse from top of the incision to the bottom of the incision using long strokes. 2, the incision is packed with sterile gauze and then sterile saline is poured over the dressing. 3, the nurse packs wet gauze into the incision without overlapping it onto the skin. Or 4, the old dressing is saturated with sterile saline before it's removed. And guys, the correct answer is 3. The nurse packs wet gauze into the incision without overlapping it onto the skin. Why do we care about not getting it on the skin? Once you get it on the skin, it can start to cause what? Tissue breakdown, skin breakdown. So that's why we don't want to get it onto the skin. Now let's look at our wrong answer choices. 1, a clean cotton ball used to clean from top to bottom. Excuse me? Guys, you learn how to do this in your first semester in fundamentals or foundations of nursing. We start in the center and we work our way out, okay? Choice number 2, the incision's packed with sterile gauze, then sterile saline is poured over the dressing. Absolutely not. That dressing should be soaked first, then we place it into the wound, okay? And not the other way around. Choice 4, the old dressing saturated with sterile saline before it's removed. Absolutely not. The whole purpose of wet to dry, guys, is that when we take off that dressing, the dressing in there in the wound that should be dry by the time we remove it, the old debris, necrotic tissue, all that dead tissue should have stuck to that dressing. So when we pull off that dry dressing, all of that necrotic tissue and debris and just, old stuff comes out with that dry dressing. That's why we're doing a wet to dry. So when we remove all of that necrotic tissue, it allows room for new healthy tissue to grow in its place. Oop. All right, guys, we are down to our last question. The nurse assesses the development of a 3-month-old boy in the Well Baby Clinic. Which of the following behaviors, if observed by the nurse, should be unexpected? 1, the boy holds his head erect when sitting on the exam table. 2, the boy tries to grasp a toy just out of reach. 3, the boy turns his head to try to locate a sound. Or 4, the boy smiles spontaneously when he sees his mother. And guys, the correct answer is 2. The boy tries to grasp a toy just out of his reach. We don't expect to see this behavior until they're around 6 months of age. But all the other choices 1, 2, and 3, choices 1, 2, and 3, we absolutely do expect to see this by 3 months of age. So that's why number 2 is the correct answer. Guys, I hope you enjoyed this video. If you did, please do not forget to like and subscribe below. I get so many emails and comments saying how I helped you pass your HESI or your ATI, or you just passed your NCLEX and you're so thankful. If you want to show your appreciation, please guys, support this channel. I'm not asking you to spend any money. How can you support my channel? Share my content, post my video on your Facebook or your TikTok or your Instagram. Anywhere, share my content to help my channel grow. Don't forget, guys, I have other resources available for you on my website, nexusnursinginstitute.com. And don't forget to check me out across all my other social media platforms. Thank you so much, guys. Please don't forget to leave me a comment what you thought about this video and what type of video you'd like to see me produce for you next. And you guys will see me on the next video.